In this session, we are going to strengthen the kidneys and the pancreas for a longer amount of time. The session duration for this is going to be about 90 minutes. So when you've reached this screen, you've already done the loading up of the patient, you've already calibrated, and you've already run the test. That's why you see the matrix results here. You should already know that I'm working on the PULSAR software. This is in demo mode. I do not have a device hooked up, and I'm also on Windows 11. So what I'm going to do here is a quick search after the results come in and just take the kidney itself or a kidney hormone or something, kidney disorders. I'm going to pop these here into these hold trays and just have them piggybacked throughout the rest of the session. Going to hop down to emotions, and shock and fear would be a good one, anything related to the kidneys. Right, so we've got these loaded up. I know I'm moving a bit quickly, but that's kind of the point of this session when I've got another call in 1 hour. So go up to reporting, add 200 remedies to info, click the enter key. Reporting, add bottom remedies, click the enter key. Reporting, add the values, click the enter key. You see where I'm going with this? Programs, risks profile. Let's find the kidney and go for it. I would suggest for you specifically either sugar regulation or kidneys. I know it seems a bit weird, but that's because I just work how I do and I get good results, God willing. So click virtual doctor test, good. If I'm moving too quickly, I do apologize, but I'm doing a 90-minute treatment session in less than an hour. So as you're waiting for things like this to load, click treat all on panel, of course. You can load up your background programs. Keep in mind, third eye stimulation as of this time, December 2023, this slows down the rest of the program. So I tend to skip the third eye stimulation. I opened up body viewer. I'm going to click on program start, load unconscious choice. Again, I click the therapist unconscious choices, treat disease path while old trauma. I'm going to be going here and looking at kidneys. Also going to be doing the brain, all of it. I keep clicking treat all on panel until this here rectifies 85% or higher. Going to be loading up the brain as well, all of it. Acupuncture, just scan the partial meridian system. You can see now that I'm not warming up the body, quote unquote, how people always say, warm up the body, do this, do that. Once you learn the software inside and out, click on homeopathic extras. Just watch the screen as I'm doing this, because I'm going to be explaining other things as I load up things in the background. So basically, you're going to copy paste all of these wonderful things. Control V to paste, clicking on activate, Brill. Close. I would do psychic energy stabilization. You can also do injury and trauma repair. But I'm just setting up these background programs as I'm running things in this main therapy window, right? And I still haven't reached 85% or higher, but for demonstrative purposes, let's pretend that we have. So possible most stressed organ, small intestine. Keep in mind, this is dummy information, but what I would read into this is something in the small intestine is then affecting the kidneys, linked to skeleton. For the logical mind, it doesn't really make sense, but again, this is in demo mode. If you ever want more information, click on entangled intertwined areas, parasites, right, double click, enzymatic pathway. Are there parasites affecting the enzymatic pathway and how, in which organs? Sensory, detox link. So the more you detox, the more sharp your senses are going to become. So what I want you to do specifically, the patient that I'm making this for, in order to avoid the kidney and pancreas transplant, nip it in the bud. The way you work is a lot faster than other people. So use that to your advantage. It's just one of your superpowers. Everybody has superpowers, whether they know it or not. So kidney and bowel flora. So this gives you a bit more information to work on. If you want, you can chase down the rabbit hole. keep clicking, hormonal, right, enzymatic pathway. Okay. So what we definitely want to do is be working on detox in every single session. I'm just going to click on treat all here and just let it run. So as you can see, well, if you had a nucleus device or an edX, you'd be using the second waveform generator. If you're on your SCIO, a second waveform generator is not built in. So you're going to go back here and just add this, add that, add whatever you'd like, unconscious selection, for example. Go back to the main window, keep running other things in the background. So for me, I just click on either the degen scan or the emotion scan. So click on one, it'll load. What I do is I scroll back up because I've got an external keyboard with a trackpad on it, so I can not be so affected by EMFs, but also work a little bit faster. So explore the risk of kidney, could be immune system, could be sugar regulation, whatever you'd like. Click on detox, emotional release, radiation. If you've had chemotherapy, work on that too. Chemotherapy effects are a little bit different on the body than just detoxing, so I would leave it unless you've actually had chemo. Just type in whatever and click on treat, and again, hit the enter key. So I hit the enter key again here. In that main therapy window, I keep getting pulled back into it automatically as soon as it's finished. And you know why? Because in the first video I made, the one that's talking about the shorter 40-minute session, I basically describe that the main therapy window is going through the harness, and all of these other background programs, like these ones here, are running in subspace. I call them background, but they're running in subspace. Notice how I did this as quickly as possible. I clicked on treat all, or I hit the enter, clicked on this first, and then I hit the enter key. It treated all of these. I had just that one color to click on, so I clicked on it, and it was fast. If I clicked on that button, treat all, it would have taken approximately 8 seconds longer to run, or 10 seconds. Keep in mind, you're running the session yourself. I get it, that you can't always, do everything and not get a headache. However, when I'm doing sessions, I often just run through this, speed through that. And it's even better if the patient is in a very delta brainwave, half asleep kind of state, because then I can just run through stuffs. And I say half asleep because if they're actually asleep, other things could be happening to their physical energy body in the astral plane. So through that access point interface that is the human existence. Cool. So let's pretend that this has rectified 100%. We're going to click on end, click on close. We're going to click on any of these, arbitrary, just click. And then type in here, kidney, right? Got it. Continue test nosode and isode on the specific organ. Keep opening up other things in the background. Just keep running, blah, blah, blah. All right, you've already seen this kind of stuff in the first shorter video tutorial session that I made. I always click on treat top 5. I always just run therapy right away. And then I kind of look at stuff and I paint a picture. Okay, protozoa, worms, etc. Keep in mind, this is data for myself, and it's also in demonstrative mode. So I've got dummy data. Forgive the beer burp. I've also got dummy data here. Stomach violation. Could it be the carbonation? Right. So we've got all that kind of stuff. Keep double clicking each line that calls out to you. So again, I'm running this tutorial on kidneys and pancreas. I don't have issues with those. So even if it's running without a device, it's still not going to pull anything. Control V, because I still have all this kind of stuff in my clipboard. And unconscious search. Oh, sorry, I already clicked that. It has all that kind of stuff. Control V, paste all that bit there. And I would do digestion here. And then you can just click anywhere on the screen, activate piggyback, good. Hydration detected, give clients some water. Cool. And you would just keep going, click, 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 blah, blah, blah. If you ever exit out of something, let's say you misclicked, you didn't want to treat top 5 and you don't want to wait another 2 minutes for that to finish, you press escape 4, 5, 1, 2 in succession, not holding everything down all at once, and you can kill that window. Close out of here and you've got the detox. Click on this button, stimulate detox. Again, you're going to get this SCIO is working or nucleus is working. Click on allopathic detox because you are taking 2 blood pressure medications, pharmaceutical stuffs. Cool. That's done, dusted. And you get a rectification result. I think here or somewhere, the rectification result shows up. So I just killed that window. You can see that it's still running in the background. Right, that's all of that. We're going to be working on stem cells as well because it's a longer session, because we have time for that. So the kind of stuff that I'm digging into as a practitioner is miasms, karma, past life, DNA, genes, hereditary dysfunctions, all that kind of stuff, because you've had, basically because you've had type 1 diabetes for a long time and because you're so young to have this kind of organ failure without, or organ degeneration, I guess I should say, without having overdosed on chemical drugs, for example, without a certain, a car accident, which, causes blunt force trauma to your organs. So please leave this kind of stuff for me. I know it might be tempting to mess around with this stuff. You can if you want, you're a free person. But I think with the time that you've got, the best thing for you to do is work on your stem cells, because you're going to be working on regrowing your organ tissue. So this keeps popping up. I don't know why, just probably because I've tried to kill the program too often. So we did the treat stem cell balance, great, and stem cell stimulation, great. And the next thing we're going to do, I'll ask Linda to take notes of all this kind of stuff. So that way I don't have to take up more time and write it all down. We've done all that. The other thing, so that was detox, great. That was literally the detox. We can also work on the detox organs if you have time. I doubt we're going to in this 90-minute long session. What we're going to do is work further on the stem cells. So head over into the blood, and we've got immune stimulation and blood cleanse. That's always a good thing. So click on that, wait until the purple rain reaches 100, and then you click on end. That's a little shout out to my earlier session for the 40-minute short thing. And then you're going to do the stem cell stimulation. Voila, hit the start, wait until it's 100, hit end. You should recognize these AFE windows, autofocus emphasis windows, by now. Cool. I doubt there's anything you'd want here. If anything, it would be blood toxicity, and specifically for you with this patient case study, anemia. So there you go, and run each one for a minute by clicking start. You can tick any of these boxes you'd like. As these programs are running, what you're going to be doing is digging through the matrix scan results. So let's open up emotions NLP. Brilliant. And you can always do the unconscious choice. Keep in mind, this is dummy data and for myself, not for anything to work on regarding kidneys and pancreas. So general cure and general health. I'm willing to bet you've got hypoadrenia as well. So you click on these, you'd let them run, typical AFE window. As that's running, you're still finishing up your background programs. So I'm not going to do quantum prayer. I think we covered that in a previous video. Iridology is simple enough. I mean, what you see is what you get. Click through all of these, select something, blah, blah. It's pretty easy. Open up the Matrix Explorer, and while you're running programs in this main therapy window, you're going to literally load up everything else you can related to kidney. So here's what's extremely tedious is I'll go and, for example, take all of these related to kidney. So can ID kidney or bladder disease? So if you want, go for it, take that, and just, type this in next to all of these index numbers, basically. And so you're going to be wanting to run 383, comma, or double space in between the numbers, 1799, double space, 5996. You see where this can get a little bit tedious? Just work on it bit by bit, just slowly but surely, and after a few more sessions, if you're able to work on yourself without getting headaches or becoming too drowsy, and just rest when you do that. That's your body absorbing frequencies. That's a good sign always when you're receiving this kind of therapy. So you'd want to just go and type in all of these index numbers. We cannot export this yet, but more and more stuff is being built into PULSAR. So wait until sometime in 2024 and maybe we'll have that ability. So we're gonna close out of the matrix Explorer unless there's something specifically that you want to work on. For example, the kidney itself, which was here. Double click, it's been added to the queue up here. If you want to check and remember what you added to the queue, just click on it. There you go, kidney. Voila, that's simple. And special therapy, close. The rest of the emotions NLP, so aside from general cure, general health, and hypoadrenia, you also have bladder control. I know that sounds crazy because you're not wetting the bed, you're not a child or adult with bladder issues, but your bladder and your kidneys are connected to each other. So this is making you more conscious of your mind or mental control over your bladder and kidneys. There's a connection. So I would definitely run that. If you do have any neuropathy caused by your diabetes, run that. I would not necessarily run any of these unless you really, really need it. If you're too EMF sensitive, that kind of stuff. There is treat fear and paranoia in here. And I like that because fear is related to the kidneys. What you're also working on doing is bringing up your unconscious reactivity. So the R in the VAR hope, you want that to be a higher number, like 85% or higher. And then that means you're doing okay with your unconscious resistance to change or cure. So in this unconscious reactivity panel, what you're going to be doing is, I was taught -1. Other people enter in whatever age they are currently, blah, blah. Sometimes I enter in 300. What am I going to be like when I'm the age 300, 350? All this kind of stuff. Click on treat emotional profile above. What's really, really helpful is clicking here on disease type and enter in the, let's say endocrine, because nephrotic isn't here. So endocrine or genetic, and then whatever, kidney, cool, and then disease path, this button here. And it'll do some thinking and then it'll spit out some data, thinking, researching, whatever. By the way, you can open up as many GGen scan windows as you want, so just keep opening them up. I know you're kind of on an older laptop, so it depends. I don't know exactly how much random access memory you have at the time of this recording, but when your computer slows down, just slow it down. So what you do is take a look at all this. Take a look at all this information. You can, I believe, double click and all this stuff is going to be run. This unconscious reactivity is a really, really good program to start working in. And the other one, specifically because of your being a projector, as it's called in the human design program or whatever, but specifically because people love you so much for your energy. No wonder why your kidneys are drained, and your vital life force is, drained. Go into the covert thought pattern, stuffs that you're thinking that you're not even aware you're thinking it. Step 1. So take a look at these kind of things, and just, you can double click each and then just double click anywhere on this hold tray and it'll zap everything that's in here. But the best way to use this panel, yeah, sure, you can zap it, but maybe write down in a journal, make some notes about this kind of stuff. What is a social secret, personal secret, self secret? And then especially transcendental. What is preventing you from that state of perfect balance, which people call enlightenment, but literally it's just perfect balance until whatever our bodies are gone or whatever, our bodies are just a vessel that houses so much more. So this is interesting stuff to consider, and maybe stuff that you want to go deeper into meditation on. You can click that button if you'd like, because as your body recovers, your mind has to also plan out and think and design a new way of interacting with this world, a new way of living and operating within this world, this 3D, 4D, 5D world. That's pretty much everything that I would do here. Let's then time therapies. Sorry, the ones that I've done before. So flexibility is actually really good for the lymphatic system. Muscle building is for the kidneys, and blood sugar disorders. We've, done all that kind of stuff. Feel good might be good as well if people are kind of bringing you down a bit. That stuff. So we're going to close out of here. Nutrition. This is something that you want to spend a lot of time in. So we've got stress and cortisol, this one, as well as the female problems. I would work on both because you're female of childbearing age. So currently, the stress hormones bring up, correct results, etc. Keep in mind this is demo mode, so maybe no, don't use the questions. Yeah, okay. So this is still a bug where the female hormones should be bringing up female hormones, or just hormones, period, for, related to the reproductive cycle rather than adrenaline, cortisol, etc. So that is an issue, and I don't know if it's just a display bug or what. So feel free to keep clicking hormone balance, ovaries balance, stuff like that. And in the stress and cortisol, same thing, adrenal balance and stuff like that. Because in the risks profile, we saw that things were linked to the enzymatic pathway, I don't know if you would want to increase or stabilize. So I clicked on increase. I don't see anything highlighted in bold, so I'm guessing you don't need to increase, but to stabilize. So it's saying stabilize lipase production. You click on this button. Keep in mind, this is myself and dummy data. So what I'm, logically guessing is that you'd need to increase some enzymes because they're not being produced for whatever reason. It'll run for a few seconds. You're going to see your rectification result here. You want 85% or higher. Keep clicking that button. If you want, you can do overall enzyme production. So stabilize is just kind of lowering, balancing it out. Increasing is increasing. So for example, if people have a normal thyroid function, but they just want to lose a bit of weight, a little bit dangerous, but if you feel experimental, you can increase hormone therapy and just increase slightly your hormone production. I wouldn't do more than 2 or 3 sessions of this because you don't want to give a person an overactive thyroid forever. I wouldn't even do this to a person coming into clinic. I would tell somebody who owns a device or is renting a device or borrowing one or something, but you don't want to create a problem with the thyroid and then just let people, go do their own thing. The endocrine system is really sensitive, and it's something that Western medicine finds very difficult to rectify. So work on, whatever could be in bold print that's coming from the subconscious or superconscious. I think it's the superconscious. Selection, run it, you get your rectification result, we'll close. You can look at general digestion, take a look at this kind of stuff. I would actually deep dive into this and work on, these. All of these are going to be run when you click this button, Nutra Energy Balance. So intertwined with kidney, inherited virus, hyperadrenia. Obviously, I take a look at these things, but I also just kind of get to them when I can. So right, so general digestions, enzymes we already did down below on with those buttons. Protein digestion, especially for your kidneys, you're going to be wanting to run this. And you get the rectified result here. So keep doing all of those. All of your digestive system is going to be helping you. That should pretty much be it for that. We're going to skip the DNA hereditary stuff. We're only going to need a few sessions on that. You can hop into short start codes, hunt down your kidneys, do stuff like that. I usually do it in the biofeedback systemic relaxation window. No. I'm basically just looking for pancreas or kidney. Cool, pancreas. So what I like when I'm setting up background programs, doing stuff like that, I tick this box AFE, autofocus emphasis. And that way, when you click on scan and treat iridology, it turns into an AFE window. It just makes it so much easier. You just let it run until it reaches 100%. And then all of these here, repaired inflammation, infection, degeneration, toxic, all of those should be, when this AFE window reaches 100%, these should all be 85% or higher. So we're not gonna wait that long for demonstrative purposes. Close, great. And then we see here. I know it seems a bit counterintuitive, but you want 85% or higher because it means that's how well infection has cleared, inflammation has cleared, that kind of a thing. So got a few more things that you can go around and work with. Adrenal glands, for example, you can do that same AFE window stuff. And I'll close out of here. And working on your electrical body. So your body's warmed up by now. Like if we're actually running all this stuff, we're a good 30, 35 minutes into the session. Start meridian therapy, and then you're going to click on this button again, or the retest all button, and it's just going to go and align all of your meridians. So we're just doing this as we work on your body. So for me, if it's a 90-minute session, you don't have to do one thing first necessarily, if that makes any sense. You just, with the closing procedures, you make sure to kind of cleanse and clear out the body electric, and then, that's how you wrap up your session. Cool, so that's pretty much all we've done with this. We can go back, delete the kidney, and open up sugar regulation, which is here. Cool. And then virtual doctor test. If we just forgot something, we could go back to the screen, but I want to go into the test, let it run, etc., etc. It's interesting that sugar regulation and anger is coming up. That, oh no, that must have been from the old one. So patient/client is poisoned. Poison means it's a toxic buildup, and that can literally be from environmental factors. It could be perverse energy. It can be poor diet, loads of stuff. Or it could be, for example, your kidneys are malfunctioning and you're no longer able to detox this, that, the other. So you want to keep clicking treat all on panel until it's rectified 85% or higher. We're going to then maybe deep dive a little bit further, look at the most possible stressed organ. It's probably the pancreas, but you never know. Toxicity, double click, you're just getting some more information here. Blood, bowel flora, toxic burden. Cool. You don't have to run the detox again because we just did that. I just kind of like taking a deeper look to see what's going on exactly. So we're going to close out of here. Don't forget to do your minerals. Click here on that button. Take a look at what's going on. I would specifically look at your pancreas and then look at your kidney. Take a look at what's going around. So if you click on any of these 3 times and they do not rectify higher than 85%, forget about it, move on. You might want to supplement with taking that, but keep in mind, you can buy all the expensive supplements in the world. I'm double clicking here just to short sap that one at a time. So this way I get more information. Keep in mind, if I was running through this session, doing it really quick, what I do is single click all of these. They'd pop down here. For example, if I'm going to rush, I'm going to single click things that are under 60, above 100, that kind of stuff. I'd click the button test and treat hold items, and it's doing all of these. Now, for me, I like a little bit more information, like a little bit more data, at least, in a once a week session. So I like running, for example, just calcium to be like, okay, what's going on here? I can double click or single click, sorry. I think, no, double click. So single click just pops it down here, like I said earlier, and double clicking just zaps it for a short few seconds. And you get your rectification result here. If you click it 3 times, thrice, and you still don't have a good rectification result, move on. Just double click, delete, whatever, make a mental note to maybe supplement with calcium. The difficult thing though, honestly, is it's a hormonal issue. D3 is classified as a hormone now since a few years, blah, blah. This just makes it harder. So even if you supplement with calcium, specifically calcium, right? If you supplement with it, doesn't necessarily mean that you're absorbing it into your bloodstream or into your bones where it needs to be. Due to hormone imbalances, calcium is driven out of the bones, and then it'll land in the small joints. It'll pile up there, cause some arthritis. Same with the uric acid and just all sorts of just stuff. Yeah, the body is a weird thing. So yeah, you can be lazy about it or fast and just click, 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 anything under 60, above 100, and then click test and treat hold items. Or you can do each one individually just to see how well you absorb these kind of things. Obviously, be smart about it. Don't go find an arsenic and be like, oh, I'm going to drink arsenic every day. Yeah, that's my disclaimer for you. Use your common sense. Cool. So you did the minerals. You want to go to amino acids as well. Work on all this kind of stuff. You can test kidney specifically, and then work on that. Cool. So these numbers change because it's measuring in specifically your kidneys. What is it low on? What is it high on? Anything that's a higher number is acutely needed. Anything that's chronic is chronically deficient. So you're probably, what I'm going to say off the bat, I see a lot of low numbers. I would say you should supplement for this stuff. Be careful because you don't want to throw too much at your body all at once. But if you're chronically low, if a lot of these numbers are below even like the 50s range, a lot of them, you might just want to take a really good amino acid supplement. Or I think, isn't it like 4 tablespoons of chia seeds a day have all the amino acids we need? So, all right, closing that. If you are EMF sensitive, open up the perverse energy, electromagnetic static window, click all of these. I mean, this panel should be familiar to you by now. So cool, run that, do that. That's good. What else are we doing? We looked at both of those. If you want, you can redo the virtual doctor test just with stress. Make sure to always hunt down your kidney, find it, hunt down sugar regulation, and run it. When you get back to the main matrix, that's when you're going to hop up to your queue, and everything that you've put here, if there's loads of items, what you'd want to do is the autofocus zap and zap all from filter, and it'll run for 5 minutes. If you only have a handful of them, click and drag here, click that treat button, and you're just going to short zap all of them, and you're going to be looking for a good reactivity number. Again, you want 85% or higher. With the shaping, the way that I've been taught it and understand it is that shaping is more of a permanent kind of thing. So if you have a good rectification and a good shaping number, that should mean that one session should do the trick. with you and your weak auric fields, for example. I remember how sensitive you were and still pretty much are. It takes a lot to really strengthen yourself and not have, I don't know, if there were too many hooks energetically in you, or if there were too many black magic or this or that. And especially when difficult things happen at the hand of our loved ones, from the hands of our loved ones and trusted, and be it family members or even loved ones that we've chose to be with, it's difficult. So if you click anything 3 times and you don't get, like demonstratively, if you don't get a good rectification result, then just skip it and move on. This is also, for example, where I wouldn't look at kidney, but I would look at maybe diabetes, mellitus, perfect. We want that one. Is it mellitus or brittle? The ones for the, pancreas. I can't remember if you have the brittle or the pancreatic diabetes or the nephrotic diabetes. But yeah, so click and drag, bring this down here. I mean, I would do it anyways if you have the time in a 90-minute session, which I believe you would. You can short zap it, the disease itself, but you can also click this button, check for mental echo. And what it's doing is it's kind of gingerly tapping around the edges of the edges of you, the edges of this disease, and how and why it's making its home inside of you. If that makes any sense, double click these things, and each one is a short zap. Again, don't waste time on it. If you click 3 times and it doesn't rectify higher than 85%, leave it, move on, and then just keep going down, 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 and working on all of these. Work on all 4 of these buttons specifically for your disease. Brilliant. Everything else, like the kidney itself or whatever, you can absolutely, short zap those things too. In the shorter 40-minute session that I made for you, we clicked on biofeedback, systemic relaxation, and we worked just on the kidneys and the pancreas in here. Do that again, please. Doesn't matter if it's a short session or a long session. Work on those. You run digestion if you'd like, blah, blah, all this kind of stuff you already have seen. Brill. Cool. And the rest of the stuff that we're going to do, I'm not quite sure. We've got to look and see if you have parasites or pathogens. My guess is yes. So if you have a bit of time, you're chilling out, watching a movie or something with your loved ones, this is the easiest thing to do. So all top pathogens, that's just the easiest one. And you want to keep cleaning your body out. So detoxing, but also killing off pathogens and parasites. I don't believe you have kidney stones, but if you do, this is something you'd want to be clicking on. Degenerative tissue is a good one, because you do have degeneration, things falling apart, I guess you could call it like that. And the rest of the session, so everything that we've run through has brought you past the 1 hour mark so far. Obviously not right now, because I'm just racing through things before a meeting, but you'd be running through all of this. I'm trying to think if there's anything I've missed. I really don't believe there's anything I've missed. We're not going to get too in the weirdo, like past life whatevers. If you want to, go for it. It's under the anti-aging and in the past life program. I haven't really been able, Linda Locroto could probably help you out more with this. Because right now, you're just working on your physical body and its connection to this, that, the other. So let's close out that. We already did enough things here. Well, oopsies, I didn't mean to click on that. I did mean to click on the X though. If you want, you can go into dollar. So you can just kind of explore different windows and be guided to what you need. However, this is exactly what I would be working on. Electrophysiological oscillation is good as part of the closing procedures to subspace morphic trans, click on start, to clear out the energy body, the chakras, and the higher planes of our existence, as if our existence here could be echoed in those, mirrored in the heavens, as they say. This will run for a little bit. So basically you would keep popping back into your background programs and keep looking at, disease dictionary, did it stop, whatever, is it still running, blah, blah. You can do the unconscious choice. I normally do that just out of time reasons. Like I'll click on this, click on that, just get it running. Keep in mind, remember this is in subspace, not going through the harness. So it's kind of a gentle tickle, as my trainer said, or for me, it has like 10%, 20% of the strength. And you can obviously look for, I don't know, pancreatic, anything, pancreas disease, maybe. You can go and search for this stuff, but always when you're in harness, focus on this main therapy window. Pardon that intrusion, it's Windows 11. Focus on this main therapy window, all this stuff in this main matrix program and stuff, because that's going to be the most powerful running through harness. And when you're killing off parasites and pathogens, just hook yourself up, be in harness. As far as other devices, which is actually going to be the topic of our lunch and learn, other devices and how to use this, use that, do whatever. Speaking of which, I'm going to check the device I have in my pocket, make sure it's still running. It is, but it needs charging. Sometimes batteries get drained a lot faster. I don't know what the heck is going on, but yeah, weird stuff going on. Cool. So we've got how to treat list of illnesses under the support in quantum medical. And you should be able to see under D for diabetes something. I don't know who's calling me, but I'm not going to answer. Anyways, I wonder, I don't think you can hear it on the recording. I think just I can hear it, I hope. So I'm just going to let it keep ringing. So anything that's rectified less than 85, you know the drill by now. Keep clicking on all of these. I put my phones on Do Not Disturb, but darn it, I still have little things like this open. And Slack. Yeah. So, tick all of these little boxes, keep clicking start, and it'll keep running all of these. Run it till it's 85% or higher. I've got to remember about the organ electrical patterns. I don't think that the kidney is in there. Let's see. Tutorial video. Let's see. I don't remember what this tab does. Let me pour myself another beer. Oh my goodness. This is why my protocols are not public. Because a lot of people would think that I'm really I don't know, like not taking your life seriously. But you know that I am. I know that you are. Also taking your life seriously. Adipose tissue treatment. This doesn't make any sense for me. So it could just be because it's in demo mode and I killed that other subspace morphic trans earlier than it should have. Yeah, that might not be it. Cool. So you've got your closing procedures, which you already know how to do. Close out here, check current rectifications, click on OK. Click on the super blah, 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 takes many minutes, gives you the AFE window. This is stuff that you already see, already know. Click on OK. Click on close panel. And then go back into the test. And that's when you're going to be just clearing out your chakras. So go into universal biofeedback therapy. And then you've got the auto scaler. So you already did the meridians. You can do it now, or you can have done it earlier, like I showed you. Click treat all. This is in the shorter treatment session that I already made for you, the protocol thing. And then again, treat all until those are 85% or higher. I sound like a broken record. So trivector, hololinguistic. If you want to work on this, go for it. Let's say primary disease, diabetes, kidney. I'm just saying fear, or what would you say for not like standing up for yourself? And then you would not like boundaries. I don't know. So just run it 1 minute at a time. Click the start button if you have time for it. The way that I've been showing you do this, do that, etc., I doubt you would have time for this in a 90-minute session. The only reason why I limit sessions to about 90 minutes, that's mostly the limit people have for absorbing information. It doesn't hurt them. There's no Herxheimer reactions or anything like that. If people run like a 3-hour long session, it's just like continuing to pour water into a bucket that's already overflowing. You're not going to get good rectification results, number one. Number two, even if you do, your body's just not going to retain that information. I mean, the longest I've been doing sessions on myself for is like 2 hours. I don't feel any more, if that makes sense. I don't feel the vibrations of it. I don't feel the changes taking place within my body, but I just don't, it's like I'm overloaded. Just don't feel it anymore. Cool. So that's that. Awesome. The last points you've already seen: body scan and face therapy. You're going to click through each one of these. So when you do click all, or when you do click scan all, it's scanning all, and it'll have 2 foci here. Like one's blue, one's purple, or something like that, or red, or whatever. Speaking of which, it's already been a 12-hour day. I've got to remember to help my eyes. At my 10-hour day mark, I should be turning that night light thing on. Cool. So these are the foci, the blue and this reddish thing. And you just kind of keep clicking treat foci. These 2 bubbles get smaller. The chakras look like they're all misaligned, scattered all over the place. And this background color behind the Vitruvian Man is the aura. So click through each one of these tabs and click on the button treat foci. So that one, treat foci, left side, treat foci, all that, and then you go back to the Aura tab and you click on cybernetic correction. This is all part of the closing procedures that I probably included somewhere. It's essentially warming up the body can happen any which way. The body just needs to absorb frequencies for a few minutes and then it's warmed up. But when you close the body, you want to make sure that you're just balancing everything, wiping it clean. Like if I'm doing mental energy healing, what I do is literally wipe the body clean, clear it, balance it, and then kind of tighten the net. So if you think about the energetic body as being like a net, like a fishing net, you just want to tighten it and just kind of, that kind of thing. And just keep clicking retrain until all of those are aligned, and then you're done. That's it. So once all that stuff is aligned. So I'm going to run, see who called me, blah, blah, have my meeting in another 16 minutes. And yeah, apologies if it's the best I can do. Talk to you later, hon.